Hi, I'm Dr. David Hornbrook, and I'd like to welcome you to our office. There's a lot of great dentists in town, but I think what separates us and differentiates us from every other dentist is our commitment to you. We're committed to make you feel special. To us, you are not a tooth, you're not an insurance number, you're not a name, you're not a person, you're a guest, you're an individual that we care about. And we always want to make sure that you feel like a friend, like a family member. One of the most exciting things that we're doing in our office today is what I call Imperthins. We've seen advertisements for Lumineers, and the concept of providing beautiful smiles without actually grinding on teeth, I think that's valuable for so many of us. The problem with Lumineers, I don't have the opportunity to choose my ceramist, use state-of-the-art materials, or really get involved in the artistic process of what I call the smile design. But we can now offer our patients, and if you look at our website under Imperthins, you look at the before and afters, we can offer our patients beautiful, natural smiles without having to grind on teeth. Another very exciting thing that we're doing in our office is clear braces or invisible braces, and that's Invisalign. I think a lot of us as adults would like straight teeth, but we don't want traditional orthodontics. We don't want metal in our mouth, and we've heard the saying that metal mouth and railroad tracks, and yeah, it works and the end result is fine, but it's that process in between from start to finish that we'd rather not have to deal with. Well, with Invisalign, what we do is we make clear plastic trays that are very thin, very comfortable, and really invisible. And you wear those trays 24 hours a day, and we're getting the results that previously we could only get from traditional orthodontics. In fact, my hygienist is going through Invisalign right now, and even being close up with patients and talking about teeth, most of the time, none of the patients have any idea that she actually has her Invisalign trays in. A lot of times she'll take it out just to show them, and so we're very excited about it. Why don't you give us a call, come in, we have some great brochures on the procedure, because I think you might benefit from this, or you certainly might know someone that would enjoy this. You know, one of the compromises we've had in the past with aesthetics in dentistry is the use of metal. And most adults today, somewhere in their mouth, they have metal, whether it be an amalgam mercury filling or whether it be a crown that has that little kind of gray dark line along the edges. And if we don't have it, we've seen it. Well, fortunately, dentistry has changed drastically, even in the last 3 or 4 years. And we are to the point now where we don't use metal. I can do bridges, I can do crowns over implants, we can do veneers, we can change people's lives with beautiful smiles with no metal. Also, without using metal, I don't have to remove as much tooth as we've had in the past. Whether you broke a tooth, whether you had a pre-existing filling or crown that doesn't fit or doesn't look good anymore, we don't have to remove any more tooth structure. So when you come in, ask us about our metal-free dentistry, because not only is it healthy, but it looks better. You know, it seems like everywhere in society, lasers have changed the way we do things, whether laser skin resurfacing, laser hair removal, laser etching, I mean, whatever it is, laser is the hot topic. Up until a few years ago, lasers weren't in dentistry, which is kind of unusual, but today, lasers are used for so many things in our dental practice. One of the things we're very excited about is lasers with our hygienist, our cleanings, where we can actually use this very thin laser around the gums. You don't feel it at all, kills bacteria, and we're getting results that previously we'd have to refer out and have periodontal surgery done. So when you come in, be sure to ask your hygienist. Well, she'll definitely bring it up to you, but talk about the laser and the advantages and uses in our practice.